Hi friends, in this video we're going to be having a discussion about some of the important questions which will test the concepts that you learned from the topic of coagulation cascade. And as I already told you, every minute of your student time is extremely precious. Let's delve into the questions to have an understanding about the concepts that we learned from our initial video on coagulation cascade. The first question is asking about which of the following factors is vitamin K dependent. So I want you to recall the fact that which vitamin is going to be required for coagulation. This is a fairly easy thing you need to remember. K for clot formation. Clot formation is dependent upon which vitamin, that is vitamin K. Now vitamin K dependent factors included 4 factors, and those included factors 2, factor 7, factor 9 and factor 10. So out of the given options, it is easy for you to decode the fact that the factors which are going to be involved as vitamin K dependent factors, that's going to be easily remembered by you as factor 9 over here. So that means option B is the answer over here. Why do we need to talk about this particular fact? Is for the simple reason, 2 facts I can help you remember, that vitamin K dependent factors are going to be coming from the liver. So when we are talking about the liver, we understand the fact that the liver is going to be having a dysfunction. It is going to be failing in case of certain situations. Say for example, the classical history that they put up in the exam is a person who is taking alcohol for a longer duration of time. Now, if a person is going to be having hepatic dysfunction or liver dysfunction, he is going to be having under formation of all the clotting factors, and that can include vitamin K dependent factors as well. The second thing that you need to remember is vitamin K is an example of what we call by the name of a fat soluble vitamin. So in a condition in which the patient is going to be having fat malabsorption, this is typically going to be associated with the term steatorrhea. Steatorrhea means fat absorption cannot take place properly, and such patients are going to be having a deficiency of vitamins like vitamin A, D, E and K. So any individual who is going to be having a deficiency of vitamins A, D, E and K are already going to be having a dysfunction at the level of the coagulation cascade. Now why I am talking about these two things? Whether my patient is going to be having a hepatic dysfunction or my patient is going to be having a problem at the level of the fat soluble vitamins, he is going to be having a deficiency of these clotting factors. And out of the clotting factors that I mentioned, 2, 7, 9 and 10, it is factor 7 which is going to be having the earliest exit from the body. Now if the factor 7 is going to be having early exit from the body, it is going to be interfering with activity of the extrinsic pathway. And we all understand the fact that extrinsic pathway can be monitored with the help of a parameter that is given the name of extrinsic means external. So what game were you playing externally? The game that you were playing externally was tennis. So whenever you have a patient who is suspected to be having liver failure, or any patient who is going to be having a steatorrhea, having a deficiency of vitamins A, D, E and K, they are to be monitored with the help of a parameter which is PT. I already shared with you in the main video. If you haven't watched it, I request you to watch it again. We have a better parameter in place of PT, which is given the name of INR, that is International Normalized Ratio, which is to be remembered over here. Second importance on got factor 9. Factor 9 deficiency can be seen in people who are going to be suffering from a genetic problem, which is given the name of a hemophilia. Which hemophilia will you associate with factor 9 deficiency? Of course, you know the answer for this question. That happens to be hemophilia B. Talking about the next question, which of the following initiates the extrinsic pathway of coagulation cascade? Extrinsic pathway means something coming from outside. And this is typically going to be seen because of the presence of tissue damage. Tissue damage is responsible for the release of a factor which is given the name of tissue factor. And this tissue factor is responsible for causing activation of factor 7. After factor 7, you were talking about activation of factor 10. Then we get activation of factor 2. Then we are going to be getting into activation of factor 1. And this, in the help of factor 13, is going to be responsible for the formation of a proper stable clot. So whenever I'm talking about the extrinsic pathway of coagulation, extrinsic pathway of coagulation is going to be taken care of with factor option C over here, that is tissue factor. All the other factors which have been mentioned over here, factor 12, factor 9, and are going to be involved in the intrinsic pathway. Factor 10 is going to be involved in which pathway? Both intrinsic and extrinsic. So it is a factor for the common pathway. Talking about the next one, a patient of yours is having the presence of prolonged PT but normal APTT. Normal APTT means normal activity of the intrinsic pathway. Normal activity of the intrinsic pathway. But the problem at the level of prolonged PT means a problem at the level of extrinsic pathway. So which clotting factor is involved in the extrinsic pathway? If you understand it, obviously you will be able to crack it easily. Factor 8 is involved in the intrinsic or extrinsic pathway. Factor 8. Remember this diagram because this is for your ease. In the intrinsic pathway, you are having the role played by factor 12. You are having the role played by factor 11. You are having the role played by factor 9. You are having the role played by factor 8 and factor 10. So whenever we're going to be talking about the intrinsic pathway, factor 8 is a part of intrinsic pathway. Factor 9 similarly is a part of intrinsic pathway. Factor 12 is a part of intrinsic pathway. The answer therefore you have to remember is factor 7, because factor 7 is going to be a part of extrinsic pathway. This is what is going to be activated in the presence of tissue factor, which is also being given the name of thromboplastin, and that is what is going to be causing activation of factor 10 and the subsequent pathway that we talked about earlier. So any patient who is going to be having prolonged PT and normal APDT is going to be having a deficiency of factor 7. Classical example of this situation is what I shared with you just now. Patients who are going to be having hepatic dysfunction, particularly in the early stages, can be having this, or there can be situations in which patients are going to be having the exit of factor 7 because of underactivity of vitamin K. Looking at the next question, which factor is not being produced by the liver? So primarily all the clotting factors are being produced by the liver except for calcium. Calcium, which is very important for the clot formation, and this calcium is going to be given the name of factor 4. That is what you need to keep in mind over here. What's the importance? The clinical importance is very simple. Calcium is required for clot formation, friends. If because of any reason you are going to be decreasing the ionized calcium, the chances of clot formation is going to be going down. Now, what can be responsible for decreasing ionized calcium? This decrease in ionized calcium can be done with the help of certain chemicals, and these chemicals which are going to be used in the blood banks. So in the blood banks, you want to take the blood, you want to store it, you don't want the blood to clot. So in the blood banks, once you have taken the blood from a donor, you add a chemical which is given the name of citrate. Citrate is going to be responsible for decreasing ionized calcium. So C for citrate, it is going to be binding with C for calcium. Therefore, it is going to decrease or interfere with the activity of clot formation. That is what is going to be helping you remember this particular fact. Talking about the next one, warfarin acts by inhibiting which enzyme? Warfarin is an example of, please recall, an example of which category of drug? Yes, we know. It is an example of an anticoagulant drug. Now, whenever we are talking about anticoagulant drugs can be given by two routes. Either they can be given by the oral route or they can be given by the parenteral route. Which of the two routes would you prefer for a drug like warfarin? The drug warfarin is going to be given by the oral route. It's a very, very important orally effective anticoagulant drug. And may I remind you, warfarin is going to be acting by inhibiting which enzyme? It is going to be acting by inhibiting this enzyme. How do I get the hint? Warfarin is an example of a drug which is going to be interfering with activity of vitamin K. And the only option which is present over here, in which vitamin K is mentioned as an option over here, is vitamin K epoxide reductase. This is a specific enzyme. This is a specific enzyme that is inhibited with the help of warfarin, and therefore the patients are going to be having this particular drug as a very effective anticoagulant drug. Talking about the next important question, heparin exerts its anticoagulant action by enhancing the activity of. So heparin is an example of a drug. It is known to boost the activity of a molecule that is given the name of antithrombin. That's what we talked about, antithrombin. Antithrombin is a normal molecule which is going to decrease the activity of thrombin. So what is heparin going to do? Heparin is increasing the activity of antithrombin. Because you are increasing the activity of antithrombin, you are going to be decreasing the activity of thrombin, and that is how this particular drug is going to be exerting its anticoagulant effect. How is heparin different from warfarin? Heparin is an example of a drug that is going to be given as an example of a parenteral drug. It's an example of a parenteral drug. Second important fact that you need to remember is both heparin and warfarin are going to be having the same common effect, and the same common side effect that is going to be seen with these particular drugs is both of them can be associated with high chances of bleeding. But whenever I want to monitoring a drug like heparin, monitoring of heparin is going to be done with the help of a parameter that is given the name of, remember heparin is a drug which is going to be remembering you of something called as stable TNF. So heparin monitoring is done with the help of APTT, whereas warfarin monitoring is going to be done with the help of prothrombin type. The next one, which factor deficiency leads to hemophilia A? So if you understand the fact, if you recall this, hemophilia A has a sound of 8, B was 9, C was 11. So A is 8, that is also called as classical hemophilia. Hemophilia A is going to be seen because of factor 8 deficiency. That is what you need to remember over here. Factor 9 deficiency is hemophilia B. Factor 11 deficiency is hemophilia C. I told you the fact that these are example of conditions in which patients are going to be having a deficiency of clotting factors. So these patients are going to be having classically history of a fall or a trauma, and therefore the patients are going to be having history of too much of bleeding from any injury site. That can be including the presence of bleeding in the muscles, that can be including the bleeding in the joints, and that is what is going to be observed in the patients. Now what I want you to just have a basic idea about here with respect to hemophilia is that hemophilia is an example of a condition in which the patients are going to be having this as an example of a, especially hemophilia A and B. These are example of X-linked recessive conditions. X-linked recessive conditions. X-linked recessive conditions are those conditions which are more commonly seen in case of males. So most of the times the question in your exam is going to be about a male child who is having a history of a fall or a trauma, and this child is going to be having the development of a bleeding. That is what you have to remember from the exam's perspective. Talking about the next one, in disseminated intravascular coagulation, which of the following is seen? Now, DIC or disseminated intravascular coagulation is a term that you will hear in the critical care setups. In this particular condition, the problem that is going to be seen in the patients is these patients are going to be having a deficiency of clotting factors. If I'm having a deficiency of clotting factors, that means what? That means both extrinsic as well as intrinsic pathway is affected. If both extrinsic and intrinsic pathway is affected, the patients are going to be having, because of extrinsic pathway involvement, increase in the value of PT. Because of intrinsic pathway involvement, increase in the value of APTT. So the finding that is going to be seen in these patients will be, patients are going to be having prolonged PT and APTT value in case of DIC. Now, do you think a patient who is going to be having a deficiency of clotting factors, having a problem in both extrinsic and intrinsic pathways, is going to be having a good prognosis? The answer is absolute no. This is an example of a condition in which the patient is going to be having a poor prognosis, and that's the sad part of the story. The patients are going to be having a high rate of mortality. The next one, which test measures the intrinsic pathway? So basic test, which is going to be talked about again and again. Intrinsic, you are going to be playing which game? Yes, you play table tennis. And that is what you need to remember over here, that the monitoring of the patient is going to be done with the help of what is given the name of APTT. May I remind you, bleed prothrombin time is useful for the monitoring of extrinsic pathway. That's what we learned. Bleeding time is what is going to be useful for the monitoring of the activity of platelets. Bleeding time is not to be confused with as a problem in the clotting factors, friends. Bleeding time is something which is going to be associated with the problem at the level of platelets. And thrombin time, of course, is going to be useful for seeing the activity of factor 2. That is what is clear from the name itself. Talking about the next one, a patient on heparin develops thrombocytopenia. Very, very importantly tested concept in the exams, but that is what you need to remember over here. Sometimes when you're going to be talking about heparin is an example of a drug. It is having a very good friendship with what is given the name of platelet factor 4. And when both of them come together, they are responsible for the formation of a big molecule. Now, this combined big molecule is responsible for activation of the immune system. So, once you activate the immune system, what will happen? There is formation of antibodies. And these antibodies are going to be formed against this complex. So, when antibodies are going to be formed against this complex, what is going to be the problem? These antibodies are going to be attaching themselves with the heparin and the platelet factor 4. Now, the name gives you a hint. Where is platelet factor 4 present? That is present on the surface of platelets. So what these antibodies will do is, these antibodies are going to be binding with heparin platelet factor 4 and they will destroy the platelets. Now, if there is a destruction of platelets, patients are going to be having decreased platelet count, and the decreased platelet count is given the name of thrombocytopenia. So my patient is having thrombocytopenia. My patient is having decreased platelets. Why are the platelets decreased? Because of antibodies. What was the reason for the antibody formation? Heparin. So I can call this condition by the name of HIT syndrome. HIT is not a hit. HIT means the heparin induced. Heparin is causing thrombocytopenia. So this is called as heparin induced thrombocytopenia syndrome. And what's the problem? The problem is formation of antibodies. What is antibody produced against? The antibody is produced against platelet factor 4 heparin complex. Why do you want to remember this? Patients who are going to be having a development of HIT syndrome are going to be having the chances of bleeding, which is going to become high. At the same time, because of the presence of this kind of an antibody complex, there is more damage to the endothelial cells. So paradoxically, normally please remember, if I'm talking about thrombocytopenia, I would be having the patients having increase in the bleeding tendency. But these patients having HIT syndrome are also going to be having a chances of development of thrombotic manifestation. So patients are going to be having thrombus formation at abnormal places in the body because of the antibody associated damage at the level of different types of blood vessels. So uncommon thing, but that is what you just need to remember over here, that what's the problem in a patient having HIT syndrome? There is a problem of antibody formation against platelet factor 4 and heparin complex. We need to remember the fact what is going to be the problem in a patient having vitamin K deficiency. Vitamin K deficiency can be seen because of deficiency of fat soluble vitamins, or vitamin K activity can be decreased because of the administration of drugs like warfarin, right? Direct thrombin inhibition is something that is going to be done with the help of drugs, which we talked about earlier, which are going to be given the name of, as we made a mention of the fact, we have talked about drugs which are given the name of the dabigatran, and we talked about a drug that is given the name of the zimelagatran, right? So that is just for the sake of a concept of the coagulation cascade clinics that we just wanted to have an idea. If you found those MCQs to be useful for clarification of your concepts regarding coagulation cascade, don't forget to like, share, and subscribe to the channel, and keep on watching for more interesting videos. Also, in the comment section, you can always let us know about the topics on which you would like the MCQs to be discussed for your benefit. As always, take care of yourself. Let's make medicine simplified. Thank you.